The current COVID-19 pandemic is an example for the need for strong networks and for collaboration across the public health community. We're still trying to learn about this coronavirus and COVID-19, but it became clear early on that this is not just a problem for our colleagues working in infectious diseases. So the range of disciplines and research groups that have been involved in the problem is extraordinary. And this includes epidemiologists and research groups trying to understand the spread of the disease, health workforce researchers looking at the impact on the front line, and those studying the impact of mental health, of the lockdowns on mental health.
Social media platforms really represent one of the most important public health engines in the 21st century because they allow people from all around the world to share experience and knowledge at a way faster rate than traditional journal articles. However, especially when it comes to younger generations, it's so easy to get lost in the network because young people moving the first steps in the public health world could find themselves without a guide, trying to confront fake news, misleading messages, misleading people, witch hunters, and so on. And for all these reasons, I really believe that in the future, we still need public health associations in the real world. What I really see for the public health community in the next years is an intersection between real organizations and associations in real life, just like, for example, EUPHA at the European level, and working together with online communities to bring people together to create platforms to exchange information, expertise, to foster knowledge, and bridge a gap between the younger generations and the older ones.
EUPHA's sections are the main means of bringing together the public health experts across Europe. And the focus of EUPHA is the annual conference, which is a platform for the science. The sections work together to provide a successful conference. And there are many examples of this in terms of the pre-conferences and workshops. For example, there is a session on the implications of GDPR for public health research, which is brought collectively by sections on monitoring and reporting on public health ethics, law, health services research, and digital health. These sections are free for anyone to join, though we would, of course, encourage people to join not just EUPHA, but also the local membership organizations for the benefits that these confer.
Health is moving from a medical approach to a social approach, in which the challenge is represented by the multidisciplinary action and policies between public health experts, designers, citizens, and policymakers. Urban health strategies should be considered the early stage of urban planning as a vehicle of primary public health prevention and health lives promotion.